Welcome back to California Live. Do you have excess skin on your eyelid? I have so many friends who complain about this. They say it makes their eyes feel really heavy and they just don't like it at all. So what do you do in a situation like this? Well, we called in Dr. Tess and she has a fix with the least amount of pain. All right, Dr. Tess, what is this procedure? Why is it so simple?
Well, this is called the Sublimax, and this is the probe. It's getting smaller and smaller, these devices, and it works using plasma technology. And this is what's called now soft surgery, where there's no cutting, but we are removing tissue to retract the hooded lids, to make your eyes look more open. And right now is the perfect time to do it.
And why now is a perfect time?
Well, there's a little bit of downtime with this. The Sublimax, basically you're going to have scabs on your skin for about 7 days. And then after the scabs come off, there's a little bit of redness and maybe some skin coloration changes. But people are open to doing that now. And because we're wearing masks, the eyes are the only thing that's really showing our age, if we look tired, if we look sad. And many times, even if we feel great, aging eyes tend to make us look like we're sad and tired.
Yeah, and Dr. Tess, take us through the procedure because your husband has done this before.
Absolutely. Well, we've done the time machine procedure on Dr. James, but he does have genetic predisposition for having very heavy hooded eyelids. And this is a big problem for people. And so we decided we were getting amazing results with our patients. And so we did it. And essentially the treatment, we're using this handpiece, and there's plasma energy that is created between the Sublimax probe and the patient's skin. And then there is a tiny spark that's created that's heating the skin. And then we have what's called a superficial sublimation, which is why this is called Sublimax. Sublimation is the process where we're taking solid directly into a gas. And you can see there's almost kind of a plume that comes out of there as well in the video. And essentially you get instant retraction and tightening of the skin. And then you get these tiny little dots that heal like scabs for about a week. And then, your eyes are more open.
And these before and afters are amazing. First, let's take us through Dr. James, his before and after procedure.
So you see the before, it wasn't that bad. And like I said, we've done other treatments to tighten the upper eyelid area, but immediately after, you can already see his eyes look more open. That's going to be the scabbing that's going to happen. You see those little dots. That's immediately after the procedure. And then 3 weeks later, you can see his eyes are more open, the eyelids look, tighter, retracted, the functional improvement as well as the cosmetic improvement.
Which is a really great point. And I think this other one is a great illustration, this other before and after you have, of exactly what that little skin looks like and what it can look like afterward. Dr. Tess, how often can you get this done, or should you get this done?
Great point. There are patients where they will need more than one treatment. And so we usually recommend patients to wait at least 3 to 6 months before they do their subsequent treatment after the first one. But the great news, like I said, is there's no scars, there's no stitches, and a lot less downtime than the traditional surgical eye lift or blepharoplasty treatments.
All right. Well, Dr. Tess, thank you. We'll leave it to you. You always have a way to keep us away from that scalpel if we want to. Thank you so much.
We're offering free virtual consultations, so take advantage of that. I get to talk to you guys over Zoom or FaceTime.
Awesome. Thank you so much. Coming up, get ready for blast off. Mr. Science is revving up his rockets. Next, right here on California Live.